Good morning. Well, thank you all for joining us, and welcome to the Mason City Clinic, and I want to thank all the legislators for being here this morning. I can't think of a more appropriate venue than this location for the formal bill signing of the Iowa Health and Wellness Plan, or Senate File 446, as it is more formally known. We are in the home district of two key leaders who made the Iowa Health and Wellness Plan possible, Iowa House Majority Leader Linda Upmeyer and Iowa State Senator Amanda Reagan. From the very beginning of the session, Governor Branstad and I made our health care principles well known: improve access to care, reward quality care, encourage Iowans to take ownership of their own health, and to be sustainable over the long term. The Iowa Health and Wellness Plan accomplishes all of these goals and does so with bipartisan support. This plan allows Iowa families with low incomes to do more than just access health care. It allows Iowa families to access quality health care locally with incentives to improve their health care. As Governor Branstad and I have traveled to all 99 counties in this state, we have heard time and time again the importance of annual physicals, health risk assessments, and preventative medicine. This plan provides all of those health behaviors. We also have heard how important it was for this plan to be sustainable for the long term. I truly believe that the leadership is more than just making promises, that leadership is delivering sustainable results. And now it is my great honor to bring to the podium a former colleague of mine, Senator Amanda Reagan.
Thank you. It is a great honor for me to participate in the bill signing, which embodies the good work and from many good people and for a good portion of time. And I know the executive and legislative branches of government worked for many years on various proposals and ideas of how Iowa can best serve our citizens receiving quality health care services. Representative Upmeyer and I have been involved in those discussions since we were both elected in the legislature over 11 years ago, and probably before that. And I know scores of you gathered here today were strong advocates, and I look around the room, I couldn't name all of the people that have been strong advocates of changing the Iowa healthcare system. Today, we will codify our best effort with the signing of the Iowa Health and Wellness Plan. Ultimately, an additional 150,000 of our fellow Iowans will be eligible to receive health care at reasonable and affordable costs through an improved care delivery system. And the best part is we have arrived here today at the junction with the people, at the best part of this whole arrangement has been because we have arrived here today at the junction where people of goodwill were forged good public policy through the application of good common sense. It just doesn't get any better than that. And to get here required leadership and compromise on all sides. The governor's office, Majority Leader Upmeyer's House of Representatives, and my own Senate colleagues. I am proud of the positive contribution we were able to make to the health and wellness of the state. We all know the benefits of living healthy and having well people in Iowa. If we can get people healthy and keep them fit, then they are better able to contribute to the economic progress of our state. They can better support their families. Their children will do better in school, and their burden on the health care system can be significantly lessened. A friend of mine once noted that the goal of public service should be to improve the lives of our citizens. Today we take a bold, affirmative step towards that goal, and I am very proud of what we did together to be able to accomplish that for the people of Iowa. Thank you, all of you, and all of you standing here, and all of you, and all of you, for what you have done to make this happen.
Good morning. It is so great to be here, and this is indeed a day of thank yous. First, let me begin by thanking everyone engaged with the May City Clinic, the staff, all employees, the docs that work here, for inviting us to be here today and making it such a special day. I have to tell you, it's so nice to be back here, and it's so nice to see so many faces of people I used to work with every day, and I miss all of you, and so it's good that I take you with me every day to the legislature. Thank you to Governor Branstad and Lieutenant Governor Reynolds. Their vision and leadership this year has just been so helpful in showing us a path and having participation from all over the state throughout the year so that we very clearly understood what Iowans wanted in the healthcare system and were able to put that together. Senator Reagan, thank you for all your hard work. I think Amanda's exactly right. We've worked together on health issues ever since we were elected. We both came from kind of similar backgrounds in service to Iowans in the North Iowa area in a little different ways, but we've always worked on these kinds of topics, so it made it far easier to come together. And I thank the caucuses for working so closely with us and doing the job that we needed to do at the end of the day. Sometimes it's a challenge when we're moving fast and furious to get the buy-in we need, but the caucuses stepped up and understood what we were doing and participated and supported us, so we appreciate that. Thank you to Representative Heaton and to Representative Miller, who are not here today, but on the House side and their counterparts on the Senate side put together a very good budget for us to work with this year, which helped make all of this possible as well. It's a responsible budget and one we believe is sustainable. A special thank you to Representative Walt Rogers, who is not here today, but... He's here. Oh, is he? I didn't see him back there. Okay. Thank you, Walt. Thank you. Well, now everybody knows who you are. So thank you very especially to Representative Rogers for actually shepherding this through the House and persevering and hanging with us as we pull this all together. The Iowa Health and Wellness Plan is something that I can't imagine how anybody without any background in healthcare could pull this all together, but he worked so hard and talked to all the right people and made it happen, and I just thank you for doing that, Walt. Thanks so much. He just stepped up and did everything we asked him to do. At the beginning of the year, the governor laid out a plan for a health system that would meet the needs of Iowans, was sustainable, and put a good system in place that would allow for continuity and high quality care and not just waiting for emergencies to happen for people to actually receive that care. His plan provided really good, sound goals for us to work with, and with the expiration of the Iowa Cares program, which those of us in North Iowa saw lots of problems with, it created a real opportunity for us to move forward and come up with a better plan. So we utilized that structure. We worked in the House and the Senate and figured out which things we could do, where we had agreement, and focusing on the agreement. And I think that was the thing that was so helpful. And I tell you, our staff was absolutely invaluable in that process, because when we had questions about how something would work and how we would roll it out, they dug in, and by the time we got together again, they had all the answers for us, and we were able to move forward. So, Aaron, thank you. The Iowa Health and Wellness Plan does improve the quality and the continuity for individuals under 100% of poverty, those neediest Iowans who previously might not have had health insurance and didn't access the healthcare system in a way that promoted wellness. This will promote wellness. We do see this as a better plan than simply expanding a decades old and a bit archaic system that we currently have. So this will be a good thing to do. So again, thank you to everyone that provided input and support through this process, and I appreciate everybody that's here today. This makes it awesome. And Governor, thank you so much for coming to sign the bill.
Thank you very much. Wow. Linda Upmeyer, thank you very much. Good morning to all of you. It's great to be here in Mason City with the sun shining for this special bill signing. And I want to thank everybody. I want to thank our hosts here from this clinic. Thank you for hosting us here. This is a great setting to do this. We appreciate the good work that you do. And I want to thank all of you in North Iowa for your leadership. As you know, I grew up here in North Iowa, and this is really the kind of the healthcare center for this part of the state. And you do great work here. Your leadership in health and wellness is essential to success, and I want to particularly thank the two that you've already heard from this area, Senator Reagan and Representative Uppmeyer, for their leadership. I think up until the end of the session, very few people believed this could really come together and that we would actually get a bipartisan agreement and that we would have a bill signing of this magnitude. But it is a tribute to the hard work and perseverance and a cooperative environment that we had, and especially the bipartisan work in the legislature that led to this compromise. Senator Reagan was dedicated to the process and was instrumental in making the health and wellness plan a reality. And of course, Majority Leader Uppmeyer was in a very important and key position, and this is something that's near and dear to her heart. They both played a very key role. I want to acknowledge Senate President Sam Yoakum, who also played a very important role, along with Representative Walt Rogers, that's been mentioned, and many others here, representatives and senators of both parties. I truly believe that health care reform on both the federal and state levels should most of all be about making people healthier and encouraging people to make good decisions, whether it be, and obviously, you know, we have the goal to be the healthiest state in the nation, and we're working on that, but we think it's important to get people involved, but we also need to have a health care system that rewards things that are going to preserve health instead of just paying for procedures, which is kind of the way the health system's been in the past. It's the more procedures you have, the more you get paid. It was almost a perverse system that didn't lead to healthier outcomes. In just 2 short years, since we set the goal of being the healthiest state, Iowa has moved from 19th to 9th in the Gallup Healthways Health Index. I believe that Iowa Health and Wellness Plan, which was approved, will aid us in our goal to become the healthiest state in the nation. And we know going from 19th to 9th was easy compared to going from 9th to 1st. So we do have a big hill yet to climb. But I think we have laid the groundwork, and hopefully we're seeing the buy-in. And I want to say how much I appreciate the partnership we have with the Healthiest State Initiative and companies like Wellmark, Blue Cross Blue Shield, and Hy-Vee, and many others, and communities competing all over the state to be blue zones. I think is an important part of that. The plan that we're signing today increases access to high-quality, modern health care and encourages people to make the kind of right decisions. And the Lieutenant Governor mentioned things like physicals and health risk assessments and just making good choices in terms of nutrition, exercise, not using tobacco products, all those kind of things. This plan increases the number of Iowans who will have private insurance. And through the exchange program, there are tax credits for that. We think that's a positive step forward as well. Our insurance commissioner will be working on that. In the front row, we have the leadership from the Department of Human Services will have the responsibility of administering and overseeing this and getting the waiver that we must get from the federal government. I know that Chuck Palmer and Jennifer Vermeer and our chairman of the Commission of Human Services, former Senator Art Gracious is a former senator from this area, and he's a great example of somebody that's physically fit and is still actively involved in the community. Art, thank you for joining us and being here. This plan indeed provides incentives for healthy behaviors and rewards Iowans for taking ownership of their own health. This plan will lower the tax burden for Iowans statewide, and there are times throughout this session when a lot of people were very suspect that this could possibly happen. However, I've always believed that our work as leaders and legislators is all about the art of the possible and the willingness to try to find a win-win situation. Most important, something that's a win for our constituents, for the people of Iowa. And this bill does exactly that. And so it is an honor and a privilege to sign it at this very strategic location in Mason City, Iowa. Thank you very much. There is actually more to this bill than the health and wellness plan. It's got the entire health and human services appropriation. We haven't really talked about that, but we will be releasing a statement later today about that in Des Moines.
Today's my dad's 86th birthday.
Is it really? Oh, that's good.
Very good.
And yesterday was Sarah's 36th.
Oh, that's awesome.
Is your dad in good health?